So thank you, by the way, for Angine for introducing me. My name is Kelly Haggerty, as you said. I'm a community pharmacist practicing in sunny Southern Ontario, which makes this a very relevant practice topic in my region. I'd like to thank OPA today for inviting me to do this webinar for you, and for L'Oreal Dermatological Beauty for their sponsorship. Thank you as well, Angine, for being my technical support today through this presentation. Next slide, please. I have a number of disclosures that I should present to you. So again, I have commercial interests in the sense that I work with, or I have worked with boards for Seqirus Canada, Valneva Canada, and Bavarian Nordic. I am receiving a speaker's fee from the Ontario Pharmacy Association for this learning activity, and this program has received financial support from L'Oreal Dermatological Beauty in the form of an educational grant. Next slide. So today's webinar is a short but comprehensive review of sunscreens and sun safety. We have 3 learning objectives that will be covered over the next sort of 25 to 30 minutes, then we'll do some questions. There are a few slides in this presentation with some valuable charts you may want for future reference. So we are making them, as we said, available for registered users to download later today. By the end of this course, you should be able to achieve these 3 learning objectives. Review the terminology and science related to sunscreens and sun safety, discuss sun protection strategies and the importance of use at home in Canada, including a review of common medications causing significant photosensitivity, as well as treatment for sunburns. Our last learning objective is to discuss sunscreen selection and use while traveling, including products best for environmentally sensitive locations, concurrent use with insect repellents, and packing considerations when flying. Next slide, please. So let's start with a quick review of sun protection science and terminology. Sunlight contains ultraviolet or UV radiation, which is made up of different types of rays. UV radiation is a form of electromagnetic energy. It can come from natural sources such as sunlight, as well as from artificial sources such as lasers, black lights, and tanning beds. UV rays are classified according to wavelength. UVA rays are the longest, UVB rays are medium wavelength, and UVC rays are the shortest wavelength. Next slide, please. UVA and UVB rays are the types of radiation that cause sun damage to our skin, which is why we're focusing on them today. UVC rays do not reach the Earth's surface naturally as they are absorbed by the ozone layer. So we see them used, for example, artificially in disinfection and also in things like lasers, but we're going to focus on UVA and B today. UVA rays are persistent from sunrise to sunset year-round, and they account for 95% of the sun's rays. They're more penetrating than UVB rays, which mean they can affect cells deeper in your skin. They cause indirect damage to DNA, and they cause skin to age prematurely, leading to visible effects such as wrinkles. They're also associated with some skin cancers. UVA rays cause an immediate tanning effect and sometimes a sunburn. The effects of UVA rays tend to appear right away. UVA rays are the main type of light used in tanning beds, and they can go through windows and clouds, and they are not absorbed by the ozone layer. Now, in contrast, UVB rays are strongest from 1 p.m. to 4 p.m., and they account for about 5% of the sun's rays that reach the Earth's surface. UVB rays damage the outermost layers of your skin, and they directly damage DNA. UVB rays cause most skin cancers, but they can also contribute to skin aging prematurely. Overexposure to UVB rays lead to sunburns. The effects are delayed or appear a few hours after the sun exposure. They don't go through windows, and they are more likely to be filtered by clouds and partially filtered by the ozone layer. Next slide, please. UVA and UVB rays are the types of radiation that can cause sun damage, as I said. So wearing sunscreens is really important. The ingredients in our sunscreens work to protect skin by either reflecting, absorbing, or scattering UV rays, reducing the risk of sun-induced damage. Mineral or physical sunscreens work to reflect UV light. Organic sunscreens absorb it. The amount of UVB rays filtered will depend upon the level of SPF that you apply. Now, there has been a change in the nomenclature in regards to sunscreens. So what we used to call a chemical sunscreen is now called an organic sunscreen. Um, as you can see, sunscreens are going to filter sun to a different level. So it's important to understand the concepts of UVA and UVB radiation and how terminology like SPF applies to that. As you can see from this slide, UV or SPF 15 will filter up to 93% of UVB rays. SPF 30 filters 97% of UVB rays. 50 will give you 98%, and SPF 100 filters up to 99% of UVB rays. So essentially, we want people using an SPF of at least 30 applied every 2 hours, because above 30, there's a fairly small incremental change in the protection that it actually offers. Next slide, please. So once again, the term organic sunscreen has been replaced with what we used to call a chemical sunscreen. So these are the chemical sunscreens and organic sunscreens and mineral sunscreens that have been approved by Health Canada. This slide is available for your reference. It's pretty busy, but you can see there's a significant difference for which ingredients filter mainly UVA, mainly UVB, and which ones will filter both. So a quick note about tanning beds. UVA rays are predominant in tanning beds, although some do have a combination of UVA and UVB. Some special UVB only tanning beds may be touted as safe, but they're still causing skin damage. So as such, no tanning beds are considered safe to use, nor are they recommended. We're going to go to slide 10 now, please. So we're going to check your knowledge so far. This is our first poll. So question 1, which of the following is false about UV rays? Number 1 option is UVB rays are strongest from 1 p.m. till 4 p.m. Option 2, UVB rays are responsible for most skin cancers. Option C, UVA rays cause a lot of premature skin aging. And our final option is tanning beds primarily use UVA rays, which makes them a safer alternative to natural sun exposure. So which option is false? Oh, I see we get some responses coming up. It looks like most people are getting this correct. Tanning beds primarily do use UVA rays, which makes them a safer alternative to natural sun exposure, is of course the false statement. They do use UVA rays, but they are not safe nor are they recommended. So option D is the correct answer on this poll. So slide 11. Which of the following, oh, sorry, that was our, there you go. People of all ages and all skin tones require sun protection. Young babies should be sheltered from sun, and regardless of skin color, the sun can still cause damage to your skin. So again, children under the age of 6 months should be protected from the sun at all times by being in the shade, because sunscreens are not indicated for babies this young. An individual's threshold for UV exposure varies from person to person. Pale skin absorbs more UV light than darker skin, and therefore it burns more easily. This is due to a pigment, melanin, in the outer layer of skin that shields against some UV rays. The more melanin in your skin, the darker the skin tone, and better protection from the sun. However, while pale skin burns faster and more noticeably than darker skin can still get sunburns that result in warm skin, pain, peeling, and skin damage. Next slide, please. This slide is essentially looking at sun damage and the need for sun protection across different skin tones and phototypes. Essentially, the lighter your phototype, the more susceptible you are to UVB rays or burns, and a higher SPF, such as like an SPF 50, may be recommended. But no matter your phototype, we are all equally susceptible to UVA damage, highlighting the importance of a truly broad spectrum photoprotection sunscreen that's giving us protection again against UVA and UVB rays. Next slide, please. There are lots of non-pharmacological measures that are extremely important parts of sun safety. Obviously, we're discussing sunscreen use, but wearing a hat, using sunglasses to protect against sunburns to the eyes, wearing protective clothing, staying well hydrated, avoiding direct sunlight, especially during peak times of the day, are other ways we can help protect our skin from UV rays. Next slide, please. So solar protection factor, or SPF, is in relevance to UVB protection only. It is not a measure of UVA protection. Basically, SPF is a ratio of the dose of radiation that causes erythema or redness with sunscreen compared to the dose of radiation that causes erythema without sunscreen. So SPF is not a measure of time. Many things can influence the SPF needed for protection, such as the time of year, your geographical location, the time of day. So you may find at different times of the year to give you the same amount of time protection, you would have to actually use a higher level of SPF. Next slide, please. So sunscreens and insect repellents. This is a real issue when you get into countries, especially outside of Canada, things like Mexico and the Caribbean, Central and South America, Asia and Africa. There's often daytime mosquitoes, and that means you may be using insect repellent and sunscreen at the same time. Within Canada, we often don't need this. However, if you're a hiker, you may be worried about ticks. So that may be a situation where you're using an insect repellent to protect against ticks during the day, and at the same time you're wearing sunscreen. It is generally recommended that sunscreen be applied anywhere from 10, 15, 20 minutes before your exposure to the sun, and insect repellent is then applied when needed. So think of it like this. The sunscreen needs to absorb into your skin, and then you need to put the insect repellent on after so you can smell it. If you're going to reapply your sunscreen, then you're going to have to reapply your insect repellent as well. Next slide, please. So these are some examples of at-risk patients for sun-induced damage. So for example, think of your acne patients, patients taking photosensitizing medications, people with photo-aggregated allergies, because there are people who are somewhat allergic to the sun. Pigmentary disorders. You'll see this in pregnant women, people using hormonal treatments, and also patients who have had a lot of scarring, especially if it's been post-procedure. Actinic keratosis, think of elderly patients, outdoor workers, and people who are undergoing treatment currently for actinic keratosis and other sun-induced skin cancers. So these patients are going to be at high risk for pathologies that are induced from sun. Next slide, please. This is a summary chart from CPS. Now, depending on your practice, it's pretty safe to assume you dispense a variety of these medications on a regular, probably daily basis. Now, although just a generalization, be very aware of patients who sort of value a tan. Think about the teenagers, think about the sun-loving adults who are, say, snowbirds and come back from their winter vacation really, really dark. These are patients where you're really going to want to watch out for medications that would increase their photosensitivity. The other one I always like to mention is women and men. We see a lot of it in products now that are being used for anti-aging purposes. So even some over-the-counter serums and wrinkle type products may contain small amounts of retinol or other ingredients that could make them sensitive to the sun. So these are patients where that medication photosensitivity becomes incredibly important. This slide, again, is from CPS, but it will be available for you to download as part of this presentation versus us going over all the different products right now. Next slide, please. So let's talk about different kinds of skin damage that's caused from the sun. Sunburn. Now, most people are familiar with sunburn, so we're going to look at that separately in just a minute here. Phototoxic reactions are dose-related, sunburn-like chemical reactions that occur within minutes to hours of exposure to sunlight in patients taking a relevant medication. So think back to that chart we just looked at. The reaction is generally confined to the sun-exposed skin, and it's usually caused by UVA radiation. Photoallergic reactions are delayed hypersensitivity reactions after light exposure in predisposed individuals with an onset of 1 to 3 days post sun exposure. They may extend beyond the area exposed to light, and they occur in only a small number of patients. That being said, I do have a patient with this condition. So she has to be incredibly important with sun protection, hats, gloves, sunscreens, appropriate clothing, and seeking a lot of shade when she's outdoors in the summertime. Photoaging. Now we're going to get into some chronic sun-induced skin damage conditions. Photoaging. The effects of long-term exposure to the sun are commonly referred to as premature skin aging. They can be seen many years beyond normal age-related changes are noted in the non-sun exposed areas. The difference between the signs of normal aging and photoaging can readily be seen by comparing non-sun exposed areas of the body with skin on the face, the forearms, and the back of hands. In photoaged skin, changes in the stratum corneum and epidermal cells will result in rough, coarse, dull-appearing skin with fine and deep wrinkles. Dyspigmentation. These are pigmentary disorders such as solar lentigines, commonly known as liver spots or age spots, and freckles that can result from exposure to UV radiation. When we get into these age spots or solar lentigines, they appear later in life, usually as a result of prolonged chronic exposure, and they appear as round, light yellow to dark brown spots on the face, the hands, the forearms, the chest, the back, and the shins. Freckles will generally appear during childhood, after sun exposure, in individuals with fair skin and often red or blonde hair. They are well-defined red or light browns to tan spots, primarily appearing on your face, neck, chest, arms, and legs. Actinic keratosis. So these are common sun-induced lesions caused by chronic exposure. They are more prevalent in males and light-skinned individuals. Onset is typically after the age of 50. They generally appear on the face, back of the hands, forearms, and legs as a firm scaling lesion with a slight erythema. If left untreated, actinic keratosis can progress to squamous cell carcinoma. Now, there are a lot of different types of skin cancer. We won't get into all of them right now, but clearly I think most of our learners are aware that that is also a result sometimes of skin-induced or sun-induced skin damage. Next slide, please. Sunburns. Now, most pharmacists are familiar with sunburns. Remember that the redness is the obvious sign, but of course, systemic effects can occur along with the redness. Sunburns are an inflammatory response of the skin to UV radiation. They are preventable and generally self-treatable. Sunburn is characterized by erythema or redness with onset 2 to 6 hours after exposure to a threshold dose of UV radiation, which is often why we seem to get redder as the day goes on, even though we've been inside, say, for a few hours. They peak at 15 to 36 hours, and they start to regress by 72 to 120 hours. Erythema is resulting from sunbed UVA exposure will start immediately, though, peaking at 8 hours and regressing by 24 to 48 hours. Redness, swelling, pain, itching may be present. Of course, blistering can occur in severe cases as well. And as I mentioned, you can get systemic effects such as cramping, fever, chills, weakness, headache, and just generally feeling unwell. Next slide, please. So just a really quick review of the treatment of sunburns. An aloe vera lotion or gel or calamine lotion can be applied as it may be very soothing on sunburned skin. You can try cooling the product in the refrigerator before applying. It just feels really nice on sunburned skin. Avoid products containing alcohol. For mild to moderate sunburns, you can also choose to apply a 1% hydrocortisone cream to the affected area about 3 times a day for up to about 3 days. Now, don't forget about sunburned eyes. Applying a clean towel that's been dampened with cool tap water and not wearing contacts or rubbing the eyes until the symptoms have gone away is really important as well. Next slide, please. So travel may present some additional considerations for sunscreen selection. Airlines, for example, may not allow larger than 100 ml containers, and they may not allow spray formulations in your carry-on luggage. So factor in having some smaller packages of sunscreen with you when you're arriving at your destination. Especially think of cruises and resorts where porters may actually take your checked baggage, store it, deliver it to your room at a later point in the day. So you may not have access to everything that you've packed in your checked baggage. I also want to comment a little bit on this slide. You'll see a little logo there about respecting marine life. Um, it's really important that as you travel to certain locations, you respect the fact that many have either suggested or banned sunscreens that will affect marine life, that are dangerous to water-based environments. Although there are some areas that have actually created laws and banned them, it's usually just simply a recommendation. So reef safe or marine life safe sunscreens are usually mineral based, or they avoid harmful chemicals that can leach into the water. They affect marine life, including coral reefs. So some of the ingredients we often see implicated with this would be oxybenzone and octinoxate, which are the main ingredients you want to avoid. But you should also look for mineral-based sunscreens that use non-nano zinc and non-nano titanium. Now, a lot of companies will have a logo like this. It may be on their product, but it may also be on their website. So when you travel, simply a part of responsible travel maybe is to look into that. And in some cases with tours or different activities you plan, it may be right in your itinerary that they would prefer you use a marine life safe sunscreen. And again, the logos may not be on the products, but you can look for those ingredients, and you can also check company websites to see how their products rank in terms of being safe for marine life. Next slide, please. So choosing a sunscreen, there's a lot of things to consider when you choose a sunscreen. Often safety, is it cosmetically acceptable? Is there a low risk to the ecosystem like we just talked about? Is it accessible and affordable? Is it providing protection from UVA and UVB radiation? You want to look for, when possible, the CDA logo, which is the Canadian Dermatology Association, and look for terms like broad spectrum and the UVA circle logo, which we're going to talk about in a few moments, to help identify products that give you both UVA and UVB protection. Look for the characteristics of the product as well. Is it a body cream, a lightweight facial gel? Is it a spray? It's important to consider where you're going to be using it and how you're going to be using it. Can it be worn under makeup if that's relevant for you? Sensitive or acne-prone skin? Is it water resistant? So these are all things to factor in when you're choosing your sunscreen product. Next slide, please. So here's a really good example of a product label and what to look for. So you can see, first of all, on this product label, the SPF is indicated. It's SPF 50. Then you'll see that little circle label to the right. I know it's a bit small on this slide, but the circle label is showing you it's rated for UVA protection. So it's broad spectrum. There's a lot of valuable information on this other than just those pieces of information though as well. First of all, you'll see that it's an invisible finish. And that means that it's going to be very nice for the face, for example. A lot of people have asked what UVA protection means. They said we don't really have a ranking for it like we do for UVB protection with SPF, but that circle logo is telling you that at minimum, the UVA protection in the product is at least 1/3 of the amount of UVB protection. And you can also see on this product label that CDA logo down the bottom right-hand corner is displayed, showing it's endorsed by the Canadian Dermatology Association. Next slide, please. So we're going to look at a case now, and this is a very typical patient in community pharmacy. So Jennifer, she's age 35, has come into the pharmacy to pick up an antibiotic for a UTI. She's getting an antibiotic sulfamethoxazole and trimethoprim twice a day for a week. You've noticed that she has a lot of travel size products in her basket, and that just prompts a conversation about her upcoming plans. Jennifer tells you that her parents, so her dad is 72, her mom is 68, they're traveling with her family. Husband is 40, she's 35, as we mentioned. And then they have 3 children, a 7-year-old boy, a 4-year-old daughter, and a 5-month-old son. They're all going on a Caribbean cruise. They've been to a travel clinic. They're all ready to leave this upcoming weekend, and she asks you for some help in selecting sunscreen. Next slide, please. So these are just some of the things you might want to review with Jennifer. First of all, the antibiotic that she's going to be on for her UTI may increase her sunburn risk. Older parents, such as her parents, are both over 65, may already have chronic sun damage risks. Her baby needs to avoid excessive sun exposure, so staying in the shade because we don't have a sunscreen for the baby. Activities that they're doing. This is a Caribbean cruise. They may require water-resistant sunscreens. And also, some of the Caribbean locations encourage the use of ecologically safe sunscreens. And I do apologize, I can't give you a total list for this. It's something that travel clinics can work with patients on, or you can look up for your patient, or they can look it up themselves, Googling if their destination is an area where there's a ban or a strong recommendation on the types of sunscreens that should be used for ecological purposes. But again, I can tell you that some of the Caribbean islands, and think about coral reefs and snorkeling activities, that is often going to be recommended. She has to understand how much product she's going to need. We generally recommend 1 ounce of product, SPF minimum 30, applied every 2 hours. And again, let's think about the fact that she's going to want to keep some of that accessible and carry-on luggage for the arrival day on the ship, because likely her regular checked baggage will arrive in the room much later in the day and may not be accessible when they first arrive to the ship. Next slide, please. So let's kind of talk about some key points then from today's lesson. UVA and UVB rays are both dangerous and can lead to acute and chronic skin damage. There are many factors, including pregnancy, medication use, occupational, such as long-term exposure, age, advanced age usually, that can increase the risk of sun-induced photo damage. Non-pharmacological measures such as hats, sunglasses, hydration, and sun avoidance are important aspects of sun safety. And factors such as age, planned activities, visits to ecologically sensitive sites, skin characteristics, and the need for air travel compliant packaging may all contribute to sunscreen selection. Next slide, please. I've got some references here, and again, these slides can be downloaded later. And now we're going to open it up for some questions. We've reached about the half-hour point, so I'm happy to take any questions, and I'm going to ask Jean to come back on and let me know if anyone's got any questions in the chat box, and we will do our best to answer them. If there's anything that I have to follow up on, I'm certainly happy to email you out with a more thorough answer if that is something I can do for you.
Great. Thank you so much for that presentation, Kelly. I am not a pharmacist, but even I found that information so useful. So we really appreciate all the insights you give. There are so many aspects that clearly into choosing a sunscreen, so it's so helpful for it to be laid out that way. Just looking at our Q&A and our chat, I don't see any questions. So I am just going to reiterate some of the things that we talked about at the beginning of the presentation. I will give our attendees for this afternoon just a couple of minutes. If you do have any questions for Kelly, now is your opportunity to ask them. As I've mentioned and Kelly has mentioned, we will be sending out the PDF of these slides, so you will have them for reference. If you have any questions after this presentation, you can email us at education@opatoday.com. I, of course, want to thank Kelly for the wonderful presentation. And again, we're going to thank L'Oreal Dermalogical Beauty. This webinar was supported through an education grant from them, and we thank them for their ongoing support. Evaluation is actually going to pop up when you guys leave this afternoon's webinar. So we would really appreciate if you would fill that out and give us feedback. So some questions have popped up. There are some skin conditions that are triggered by sun exposure, like rosacea. So how much SPF is recommended to be used for those patients?
In general, as I said, a minimum SPF 30 applied 1 ounce on the whole body every 2 hours is recommended. Now, keeping in mind very fair sun phototypes, very fair skin, may require a higher level of SPF, maybe up to a 50. Now, if we go back, I'm going to take you back to a slide. And Jean, are you able to go back to a
Yeah,
slide?
absolutely.
Great. So let me just bring up the one I want here. It may take me a second to find it. Right here. Slide number 7, please.
Gotta go back pretty.
So as we talked about, when you go up in SPF, it becomes a very small incremental change in the amount of SPF that the higher SPF will filter UVB rays. So a 15 is only going to give you 93% of UVB ray filtration, but a 30 will go 97. Going up to an SPF of 100 is only blocking 99% of UV rays. Once again, nothing filters 100%. And that's why that minimum 30 is recommended, because if you're applying it every 2 hours, you're getting fairly good protection. Now, again, someone very fair like me, I know the lighting is not perfect on this webinar. You can't see my skin really well, but I'm extremely fair. So I'm one of those people that pretty much has to go to an SPF 50. It's also though why we no longer see as many of the really high SPF products. It can give people a sense of false security. So obviously, if you've got very sensitive sun, and you're absolutely correct, there are a lot of conditions like rosacea and others where someone's going to be very sensitive to sun. They're likely to go up around that SPF 50, but there's not much incremental value in going to the super high SPFs that we used to see, like the 100, the 110, which is why most products now will cap the SPF between 50 and 60, because the incremental protection is not that significant. Hope that answers your question.
There's some other questions coming in. Hi, Kelly. Thank you for the presentation. Is any formulation superior to others? Examples like aerosol versus a lotion.
No, a lot of it is patient preference. And it's funny because I'm a mom, but my kids are in high school now. But I really remember when aerosol spray sunscreens came out, and a lot of mothers said, "This is a game changer. I can finally get some sunscreen on my kid." Because the time it takes to rub them all down with cream, you can get a lot of toddlers and young kids trying to squeeze away from you by the time you get it on. So there's not really a formula or a dosage form, if you want to call it, or a product that's superior. I think, first of all, again, we factor in, is it cosmetically acceptable? So some products are clearly better for the face. Those are usually going to be lighter weight products, for example. A cream is really good if you want to rub it into the skin. A spray is fantastic as long as you apply a spray properly. And people don't always think to apply a spray properly. And by properly, what I mean is you're going to hold that product about 1 inch from the skin. I've seen it recommended that you do 3 to 4 passes over the skin and that you rub it in. Even the products that say they don't need to be rubbed probably should be rubbed into the skin to make sure you cover all the areas. And then making sure you have time to let them dry and that you are applying it again 10 to 20 minutes before sun exposure. No product is going to be really effective if you spray it on or rub it in, and then when 30 seconds you're jumping in a pool or heading into the water. So applying before exposure happens, taking the time to rub in all the areas, and again with those sprays, making sure you're somewhere well ventilated, that you're only holding it 1 inch or 2 from the skin because you don't want the wind whipping it all away, and that you're doing 3 to 4 passes over the skin and then rubbing those spray products in.
Okay, another question. What is the safest sunscreen for babies and pregnant women?
I have not seen necessarily a product specifically for pregnant women. Um, Obviously, with pregnancy, there are other things to consider too. You don't want someone getting overheated, causing things like dehydration because you're out in the sun too long. So in pregnancy, a regular sunscreen is fine. Some women like to use the mineral based ones versus the quote organic or chemical sunscreens, but I've not seen anything myself that preferentially would tell you that's better. When you get into babies, again, if they're under 6 months, we don't want sunscreens on them. We want them sheltered from the sun. And a lot of the products that we see labeled as baby, which are for older babies or for children, they can be sometimes a little more for sensitive skin, maybe a little bit easier, not running into the eyes as much, but there's not really one superior product.
And this looks like our last question. So guys, if you have any more questions, add them in now. What is the most invisible sunscreen in the market?
And again, in that case, I would tell you to look at each individual package. For example, a heavy cream, is going to take a lot longer to rub in. Sprays, when you think of them, once you rub them in, they're pretty much gone. really nice thin gels and lightweight creams are nice for the face that you can rub them in. The ones we think of, for those of us who are a little bit older, so I'm going to go back to saying I've been practicing for 27 years. So, no, I'm not a new graduate. If you remember back to my teenage years, we used to use those old zinc products like on the nose and that, for example, and they were really thick and white. So, generally speaking, some of those mineral sunscreens, even the newer ones, they take a little more work to get them rubbed into the skin because they are sitting on top of the skin, those zinc and titanium dioxide products. Some of them don't rub in quite as well as a lightweight gel or cream might, or that a spray would. They do provide great protection, but we don't see as often now the old zinc creams that on the nose. Remember the lifeguards used to use them on the beach and that. Um, so look at the product labeling. A lot of it will tell you how thick it is or if it's invisible, but rubbing the product in and avoiding some of the really heavy older mineral based products would give you products that obviously are less easy to, they're not as invisible. Using the newer products, you're going to get a nicer finish to them and not have them sitting on the skin.
Oh, another question has popped up. Are you able to comment on the EWG organization and their sunscreen reviews?
I
Uh,
won't comment on that directly. It's a little beyond this scope, but obviously those environmental working groups, I think that's what you're referring to. Um, they have some recommendations, but again, right now, we don't have great standards for like a logo. If you think back to what SPF is a standardized term, that UVA circle logo is standardized. But when you get into the environmental products, again, I think that's what you're referring to. Um, you'll see reviews out there, but a lot of the companies will give you a link to on their website to their logo and what that means. And some of them do link back um, to the environmental groups and how they rate. So I've looked at a few of them online just for my own use. Again, because I run a travel medicine clinic, back in my bio there, we talked about that. I do have patients where they've been asked because of the locations they're going to or the activities that they're doing that they want those reef safe, coral safe, marine life safe sunscreens. So I've brought in a couple of product lines myself that kind of do their best to meet those standards, but I don't have a great insight on what they use for those reviews, if that's what you're asking.
Great. All right. Just so you know, there's also lots of thank yous in the chat.
Thank you.
And I will say that as well. Thank you so much for this presentation, Kelly. So much to learn. I want to thank everyone who joined us this afternoon. Thank you for spending your lunchtime with us. We appreciate it. We hope you learned a lot. And again, thank you to L'Oreal for their ongoing support. Someone's asked where they can find the slides. We are going to email them out this afternoon. So just keep an eye on your email. They should be there by end of day today. All right, Kelly, any final words for our learners this afternoon?
No, I just want to thank you for spending your lunchtime with me. And I'm glad you're interested in sun safety. It's interesting because of where I work and practice. I'm from Prince Edward Island, which is not the hottest place in the country, but I live now in one of the hottest spots of the country, which is Southern Ontario. And I see it a lot. I see older adults, especially, that are over tanned, if you want to use that term. They're the sun worshippers. I see a lot of our teens that just love getting that dark summer tan. So when we think about the sun damage that can occur over your life, we think about the medications a lot of these people are on, and these are really increasing their risk of sun damage to their skin. So as pharmacists, when we look at certain medications, we look at trip itineraries, when we look at the other medications that people are on, is taking the time to talk about photosensitivity, not just from the acute stage of sunburn, but from the long-term damage as well. And also taking the time to explain those sunscreen labels to our patients. Quite often people come in, sometimes they're picking a product because of they like how it smells. Sometimes they're picking a product because they think it's the least expensive. Those things all factor into decisions, but making sure that when people ask us about sunscreens, we take the time to show them the labeling and what that labeling means in regards to their protection, again, from the endorsements from the Canadian Dermatology Association. So even though it seems like a fairly simple topic, I think it's something that pharmacists can have an impact in when we talk to our patients in community pharmacy, especially when they're asking for our help or when they're asking how they can protect their skin when you are counseling on those medications that increase their sun sensitivity risk.
Yeah, absolutely. I think especially for younger patients who maybe haven't heard all this before, hearing that from a medical professional is really helpful.
versus just hearing it from your mom
Exactly.
who's been trying to catch you since the age of 1 to get sunscreen on you. So reinforcing it as a medical issue and not just a because my mom told me so is a really important lesson that we can reinforce in community pharmacy.
Absolutely. All right. So thank you all for joining us this afternoon. Uh, Tune in for future webinars and keep your sunscreen on.
Thanks everyone for joining.